Hi, I'm Julie Dundon. I'm an advanced accredited practicing dietitian, and I'm here today to talk about superfoods. We've heard a lot about superfoods in the media. Often on the internet we can hear about superfoods on different people's websites, claiming all sorts of things about food and its magic powers. There is no real definition of what a superfood is. But to us, a superfood is one that's nutrient dense. It has a lot of nutrition in it. They can be vitamins and minerals, but they can also be other things and give other health benefits. So there's no exact definition of what a superfood is, but if you think about really super healthy foods, that's what we're talking about. So the first group are the omega-3 containing foods. So things like nuts and fish. And they're the things that are very rich in the omega-3s. And we need to include some of these foods all on a regular basis. So say like fish, we need fish, oily fish, at least 2 or 3 times a week. And that would include things like tuna and salmon, mackerel, sardines and swordfish. So the types of oils and fats that are in these fish are very beneficial for us, and they can really help reduce the risk of heart disease and reduce our cholesterol levels and even reduce some of the symptoms of arthritis. And they even say that it can delay our mental decline and improve our mental function. So maybe we need some of this every day. Would be really helpful when we're trying to work through some difficult issues at work. So we need about 400 milligrams of omega-3 fats a day. Now, omega-3 fats are often also added to some commercial products. And as a supplement, they're supplemented with omega-3, which can be useful, but you still need to eat quite a lot of those foods to get that quantity of omega-3. Another group of nutrients in superfoods are the antioxidants and phytochemicals. They're found in many fruits and vegetables, and if you think about that rainbow, eating a range of different colours, from the blue to the red to the orange, the yellow, there are many different types of antioxidants and phytochemicals, and by having that range of different colours means that we get that range of different phytochemicals. So the deeply coloured fruits and vegetables are the richest sources, so like blueberries, like raspberries. Even red wine and dark chocolate are high in the antioxidants, but along with that comes a whole lot of other things, not just the antioxidants. So what do the antioxidants and phytochemicals do? What we say, they neutralise free radicals. That sounds a bit difficult to understand, but our body is constantly undergoing chemical changes in chemistry, chemical reactions. And as a result of those chemical reactions, there's these free radicals that are produced. And then free radicals can actually damage our body and damage our tissues. And then that can actually increase the risk of cancer and heart disease and brain degeneration. But what antioxidants do is they mop up those free radicals so that they're not there as much to cause damage to our body. Another nutrient that's in foods is called lycopene, and lycopene's found in red coloured vegetables and fruits. So they're very rich in tomatoes and of course in tomato paste, watermelon and red capsicum. Lycopene has been found to reduce the risk of cancer, and in particular prostate cancer. So having plenty of tomato through your diet, tomato paste are good things to do. Another nutrient is folate, and that's found in the green leafy vegetables. It's found in the spinach, asparagus, broccoli, kidney beans, chickpeas, lentils, and we know that it reduces the risk of neural tube defects in pregnancy. That research has been around now for quite some time, and we know that women who are planning a pregnancy need to take some folate before they're pregnant and certainly throughout their pregnancy, because it reduces that risk of those neural tube defects. We also know it can reduce the risk of heart disease. So having dark green leafy vegetables as a good source of folate is something we should be doing every day. Then the lactobacillus acidophilus, it's a long name, but it's a bacteria found in some of the yogurts. and that helps to really maintain the natural gut flora, the bacteria, the healthy bacteria that's in our bowel. So we need to have the healthy bacteria in there, and if we do, then we have a lower risk of having diarrhea, and certainly helps treat some of the yeast infections that we might experience. Phytoestrogens, they're found in soy products, so in soy milk, soy yogurt and tofu. And it mimics estrogen in the body. It may reduce the risk of breast cancer, and it can sometimes ease the symptoms of menopause, but it really isn't a huge effect, but in some women they do find that can be of some benefit. And then the other thing that's quite a nutrient that's very important to our health is obviously soluble and insoluble fibres. And what does it do? Soluble and insoluble fibres help our bowels to work properly, and we need some of both. So soluble fibre is found in the kidney beans, in chickpeas, in oats, in fruits and vegetables, lentils, and we know it reduces your risk in high blood cholesterol levels and reduces the risk in heart disease. Insoluble fibre can help us feel fuller and reduce us from overeating. It can help control blood glucose levels, reduce the risk of heart disease, and improves bowel function. So the insoluble fibres are found mainly in the whole grain cereals, and it's important to get fibre from all of those food groups, so you're getting both soluble and insoluble every day. So I hope that helps you a little bit about what foods are superfoods. They're the nutrient-dense foods that you don't need very much of it to get those extra nutrients in our diet. They're certainly not, they're not proteins, they're not carbohydrates. The lycopene, the omega-3s, the soluble and insoluble fibres are all important nutrients for our bodies to keep as healthy as they possibly can. So when you read something about superfoods, it's often these nutrients that they're talking about. I hope that helps you make some more decisions in the coming weeks. Bye for now.